Good morning, everybody, UK time, and welcome to the Postnatal Acupuncture webinar, which is the fourth in the series. I'm Sarah Budd, and I'm talking to you from Devon in the southwest of England. So, to give you a little bit of background about why I'm talking to you about postnatal care, I am a midwife and a registered acupuncturist. I trained in traditional Chinese medicine between 1985 and 1988 in London, UK, and then went to China to top up my training. I came back and established a maternity acupuncture service in a hospital in the southwest of England in 1988, and very quickly this service became very popular. Initially, my aim was to use acupuncture for pain relief in labour, but very quickly we found out that it was also very useful for treating antenatal conditions and postnatal conditions. I was joined by two colleagues because I couldn't cope with the workload on my own, and you can see them in the picture there, Sharon and Kim. And we had a fantastic 24 years of treating women on the National Health Service in England, which meant that they didn't have to pay for their treatment. A wonderful resource to be able to give them as much treatment as they needed. And over those years, we reckon we treated about 8,000 women. Sadly, the service is now closed due to funding changes and so-called lack of evidence. So that's my background. Very, very fortunate to be given the opportunity to get such a fantastic experience of working with pregnancy and in the postnatal period with women. So today we're going to talk about a range of things around postnatal care. First of all, what is it and who's involved in it? What normally happens in the postnatal period, and what we can do as acupuncturists to help women through this sometimes rather difficult time. We need to look at the red flags so that people are aware of importance of referral, and the common things that really need flagging up: postpartum hemorrhage, postnatal depression, particularly postpartum psychosis. And another thing that tends to crop up quite frequently in clinics postnatally for acupuncturists are issues to do with breastfeeding and possibly mastitis. And then we'll look at a few resources that can help with these issues. So that's a general overview of what we're going to talk about today. Okay, so what is postnatal? You may also hear about it referred to as the puerperium. But basically, the definition given by the Nursing and Midwifery Council, which is the regulatory body for midwifery in the UK, is that this period is defined as after the end of labour, and during which the attendance of a midwife upon a woman and baby is required by law. And this is not less than 10 days, and for such period as the midwife considers necessary. In practice, this is usually referred to as about 6 weeks after the birth, but if a woman is doing well, then the midwife will be handing over her care to the health visitor. That's what happens in the UK, and I know that in your own countries this may well be different. But we have to have a kind of working definition of what this actual period means. Of course, it goes on much longer than 6 weeks. And really, women who've just had a baby are pretty busy and in a kind of different state, I think, for up to around a year. But that may be different depending on where you are. In the classical Chinese texts, this word, postnatal or puerperium, is translated as Chan Ru Qi, Chan meaning childbirth, and Ru, interestingly, meaning cotton mattress. And I think this is a lovely breakdown of the concept of what the Chinese feel important here. The difference in our culture, where in China they take great care to rest and recover after childbirth. And it is thought that this cotton mattress is the concept of women taking good care and resting properly after childbirth, something that we're not quite so good at in the West. And certainly nowadays, women are being sent home from hospital if they've had their babies in hospital very quickly, within 24 hours, sometimes even less. As opposed to when I started midwifery, which admittedly is back in the early 1980s, we used to keep ladies having their first baby in hospital for up to 6 days after the birth. They had a tremendous amount of help. They sometimes went to outlying maternity units where there was plenty of time to help them learn how to breastfeed and bath their baby. And by the time they went home, they were really ready to take on the running of a home again. There's also a lot of media expectation, I think, about getting one's figure back and getting back into the gym quickly after the birth. And this is such a contrast to the Chinese way of looking at postnatal care. And certainly the physicians in the ancient classics would be horrified at what happens now. Okay, so what normally happens? Well, two possibilities really, and they're kind of fairly obvious in a way, I think, are deficiency of blood and or yin, or stasis of blood. When we look at the average blood loss at delivery, it's up to about 500 mils, which is a lot, and it's easy to understand that even if you haven't had a postpartum hemorrhage, which can be something between 500 mils to up 2 litres even, a huge amount of blood can be lost, that you are going to be in a deficient blood sort of state. And again, maybe obviously, depending on the state of your blood before the delivery, this is going to have consequences. In the classics, there was a different emphasis at different times over the years, and this is difficult to compare with what goes on now. But basically, we know that having a baby is hard work, and delivery uses up an awful lot of qi. And so when we put that together with the loss of blood, there can be injury to blood and yin. And the blood vessels and channels could be said to be empty. This in turn can make them vulnerable to external pathogenic factors, invasion. So in China, again, they take great care to help minimize the effects of this by avoiding exposure to cold. And I believe that women are not allowed to bath or go outside for quite some time, particularly in the winter. The other possibility is stasis of blood, and this can come about because the blood from the uterus or possibly even placental products can be retained, leading to a blood stasis, or lochia, which is the other word for blood loss. If this isn't expelled properly, then it can lead to stasis. This in turn can also lead to vulnerability to infection. The uterus, once the placenta has been delivered, physiologically clamps down very firmly, and if you're an acupuncturist who attends births, you will probably have noticed that the midwife puts her hand on the lower abdomen and feels the uterus after the birth to make sure that it's well contracted. And it's this clamping down of the uterus around the placental bed, these massive blood vessels, and this large site of attachment that controls the bleeding. So when this doesn't happen, which could be due to possibly something like a full bladder or something being retained in the uterus, then physiologically this mechanism can't happen. Now this may not be picked up, so that postnatally a tiny little piece of placenta or some retained blood can cause the uterus to just keep trickling. And this can lead to what we call a secondary postpartum hemorrhage, where the blood will carry on coming out and not diminishing as it should do. It should gradually diminish, and it changes from being red to brown to a sort of watery liquid. And this can go on for something between 2 to 6 weeks. This is normal. So after a vaginal birth, she's probably going to have quite a lot of perineal discomfort, and this will vary according to whether she's had an episiotomy, which is the cut that is made when the baby's being born to help the birth. It is only done in circumstances where it's really deemed necessary. But if she has had a cut, then she'll have stitches, and there is a possibility also that she may have a torn perineum, where the cut hasn't been made, but the actual birth of the baby's head has actually caused a tear. And again, this may or may not be stitched according to the severity, but you can be fairly sure that most women are going to be pretty sore down there after the birth. Again, the action of actually pushing the baby out can cause hemorrhoids. They may have been there before the birth, or they may come actually just the action of pushing the baby's head. And alongside this, constipation. Constipation can have other causes, which we will discuss, but I just want to flag it up as sometimes if a woman is terribly sore, then it can actually make her constipated because she actually doesn't want to push a poo out and make herself even more sore. So you can get into a retention situation, not necessarily because she's blood deficient, but because she physically just can't bear the thought of going to the loo. Breast engorgement is fairly common and does happen immediately following the birth. The breasts have a substance called colostrum in them, which is highly nutritious and a fairly watery substance, and this is perfectly adequate for keeping the baby well fed for the first few days. But in the second, third, fourth day, it varies a bit. The breast milk does come in, and the breasts can become very engorged as they're flooded with milk. This in turn can lead to quite a lot of swelling in the form of edema, and this can take a little while to settle, and the breasts can actually be very painful. You may see midwives suggesting that the woman puts cabbage leaves on her breasts straight from the fridge, and it has to be the kind of wrinkly cabbage, like a Savoy cabbage. It's a fantastic remedy, very old-fashioned, but it does work, and this draws the extra fluid away from the breast, leaving just the breast milk. It's very common for women to get fourth day blues. Again, it may vary on the actual day, but fourth day is the most common. When they feel weepy and a bit irrational. And this isn't terribly surprising, really, when you think about the huge life-changing event that's just gone on. We have the most wonderful ability to completely fall in love with our baby the minute we see it. And those first few days of elation and people congratulating us and the love we feel for the father of the baby and all of these emotions are very heightened. But something about day 4, of course, physiologically, this is the hormones all changing as well. But emotionally, it's all a bit of a sudden realization that, oh my goodness, I have a huge responsibility to look after this little person now for many years to come. And this is a normal reaction, and a lot of family support can help get over this little hiccup. And of course, you know, depending on how well the baby behaves and sleeps, mothers are usually pretty exhausted. Again, this may be related to the sort of birth that they've had and their condition before they actually have the baby. So recovery involves lots of advice, lots of help and support. Again, I think we have to be careful about this in the West. Women are being left to get on with it rather too much, in my opinion. But actually, it's much better if they can get as much help and support, particularly for those first few days and even weeks, so that they don't have to worry about cooking meals. This can start antenatally, and I often advise my women about cooking little one-pot meals that they can get out of the freezer before they've even had the baby, in those days of waiting, to prepare good nutrition for afterwards. Because when you're breastfeeding and you're busy and the baby's not settling, it's no good just grabbing a biscuit because you're hungry. You need to grab good nutritious food that will help promote breast milk and blood building. So good nourishment is absolutely crucial. We haven't got time to go into that in too much detail here just now, but it's very easy for you to look into that. And another thing that we can offer as acupuncturists is a technique called mother warming. This is a technique that is advocated very strongly by Deborah Betts in New Zealand, and it's a technique of using a moxa stick to warm the channel, particularly the Ren and Du channels, postnatally, not during the first few days. These are days of elimination, so usually about the third, fourth, fifth day after birth. After the elimination of products and blood, it's time to start tonifying. So you can teach the patient and their partner how to do this for themselves, or they can come and see you in your clinic. They only need it a couple of times, maybe with a break of a day or two in between treatments. And it's just done for 10 minutes each side. So from the midline, at the top of the pubic hair, up to the umbilicus, roughly Ren 3 to 8, and turn her on her tummy and do the same on the back, roughly from Du 3 to 8. So from the top of the buttock crease up to waist level. And this is a lovely tonifying, warming treatment that can help build qi and blood after delivery. Okay, so let's look at acupuncture, and I really don't want to talk about protocols. I've put some points down, but these are just suggestions, and we must remember that we should always look at what's going on underneath and address that as the principle of our treatment. So points here are really just guides, and they're points that I've personally found helpful. They change according to the individual, of course, and obviously it's very important to look at your underlying pattern before you decide the treatment that you're going to use. So I'll just quickly run through things that I've found useful in the clinic. Perineal pain, well, we know that the liver channel runs through this area, so there'll be points particularly that you find helpful, such as liver 5. And Du 20 is a lovely point for a swelling around the perineum, again, which is fairly common, understandably, after the birth. So that lovely kind of raising effect that it has. After pains are quite common. The uterus is clamping down, as we talked about earlier on. It's the normal physiological way of it starting to return to its pre-pregnant size, but they can be quite severe. In TCN terms, we need to look at whether it's a deficiency type pattern or excess, and then we can choose which sort of points we might use. So if it's a deficiency type pattern, then we might be looking at points like Ren 4 and 6 to tonify, and stomach 36. If it's an excess type pattern, then we're looking more at points like spleen 10, bladder 17, and stomach 29. Sweating is quite common after the birth, and it is said that if it's occurring in the daytime, then it's more Chi deficiency type pattern. So points like large intestine 4 and kidney 7 could be useful. Or if it's happening at night time, then it's more of a yin deficiency type picture. And so points like heart 6 could be helpful there. You will have more points. I want to reiterate that, and these are by no means hard and fast rules. Insufficient lactation. This is where the woman doesn't feel she has enough breast milk. We can't really spend time on the baby too much here. That would be a different type of talk. But it's an interesting observation that many women feel that they haven't got enough milk to feed their baby, and they feel that this is why the baby is crying. There are lots of other reasons, of course, why the baby might be unsettled, and people talk a lot about colicky babies. There is quite a lot of evidence that the baby's little skull bones have to do a lot of adjustment after the birth, and they go through certainly an awful lot of pressure during the birth process itself, and that a little tiny bit of pressure on the vagus nerve can cause the baby to have an upset stomach, and vagal stimulation into the stomach can make the baby very colicky. And so a lot of women will take their babies to somebody like a cranial osteopath to adjust these little skull bones. And actually my experience of that with my patients is that it's extremely helpful and can actually make life an awful lot easier because the baby's so much more content and happy. So when we talk about insufficient lactation, is it really insufficient breast milk? The mechanism of breastfeeding is that the body is very clever and will adjust the amount of milk it produces according to demand. So there's a very good supply and demand feedback loop. So if a baby is well fixed on the breast, and this is an important issue, midwives should certainly be helping and lactation specialists helping women get this right in the early days. Then if the baby's fixed on the breast well and feeding well, then it will pull the right amount of milk through and should hopefully be quite content. The woman's breasts should be filling up in between feeds and even possibly leaking. So you will find women wearing breastfeeding bras, perhaps with pads that are actually a little bit damp, particularly even when they just think about their baby, they can actually start to leak breast milk. So in terms of insufficient lactation, this woman will not be feeling her breasts filling up. Her breasts will feel soft, particularly several hours after a feed, they should be feeling quite full. So insufficient lactation from a traditional Chinese medicine point of view can be deficiency of qi in blood or can be liver qi stagnation. So points that might be helpful are stomach 36, spleen 6, bladder 17, bladder 20 and 23, and liver 3 and gallbladder 21. And gallbladder 21 promotes the letdown reflex, and it's a point that can be easily be used with acupressure by friends, family, partners. And this is something very simple that we can teach patients, even antenatally, as a preparation, so that as soon as they feel that they need help with lactation, there's an on-hand technique that can be used in the home straight away, rather than waiting for an appointment with an acupuncturist. We will be talking a bit more about breast engorgement and mastitis later on, but basically we can think about which channel or meridian is involved. The mastitis usually presents as a wedge-shaped red area, and you can easily determine which channel is involved. And so points, just briefly here, small intestine 1, large intestine 11, stomach 44, liver 2, ren 17 and gallbladder 41. Constipation we've already touched on, but a fairly common problem In the Chinese classics, they say that there are 3 questions that you need to help with your diagnosis postnatal period. One is abdominal pain, and this will tell you whether there's retention of lochia. The second is constipation, and this can give you an idea about the extent of exhaustion of body fluids and yin and blood. And the third question is breast milk flow, and the amount of insufficiency of breast milk flow can give you an indication about how much the stomach qi has been weakened. So in terms of constipation, usually blood deficiency, and points like liver 8, spleen 6, stomach 36, sanjiao 6 to promote bowel movement, and bladder 17 might be points that you could think about using. We've also hemorrhoids, whether these are in situ already or due to the birth. The empirical point for hemorrhoids, as you know, is Chengshan, bladder 57. It's a wonderful point for hemorrhoids, and other points that could be used may be spleen 6 or spleen 9, but we will think about that. Hemorrhoids were one of the conditions we would be called to the postnatal ward to treat very soon after the birth by the midwives, who have to examine the perineal area to make sure that there isn't any abnormal bleeding, or that stitches are not healing properly, or there's any signs of infection. And if the women had hemorrhoids, and particularly those who were trying to breastfeed, we would be called to the ward to treat them as soon as possible. We would get the woman to lie on her tummy, and we would put a pillow underneath her breasts and underneath her head, and so that would make a little trough for her breasts, which would be, you know, big and uncomfortable. And with her lying on her tummy like this, we could get to the point bladder 57 and 58, if we wish to use it, easily bilaterally. They love lying on their tummy after the birth generally. It feels a bit strange, but mostly they like it because they haven't been able to do it for such a long time. And we would also possibly think about using something like Do20 to raise qi, of course with the proviso that that shouldn't be used if her blood pressure's up following the delivery. Our experience of this was that there was a dramatic effect, and the midwives who would examine the woman maybe the next morning would remark on how incredibly quickly the swelling and hemorrhoids had reduced in size compared to women who hadn't had acupuncture. So it's a really worthwhile treatment if you're in a position to be able to offer it in that way in those early days, and I really do recommend it. It can make the difference between her being able to breastfeed or not, because if you can't sit comfortably then and get into a good position to breastfeed and hold your baby, then it becomes very difficult. The point that one tends to think of straight away with persistent uterine bleeding is spleen 1, and particularly if this is quite severe, if you're in a position to help with that. But we will be looking at postpartum hemorrhage in a while. Postnatal depression, just basic points: heart 7, yin, tang, and Do20 can do wonders in the early days of postnatal depression. And exhaustion, very common after the birth. So we're looking at points that help qi and blood: stomach 36, bladder 17 and 20, and spleen 6, and very often moxa, unless it's contraindicated. So that's just a very quick overview of points that I've found useful in my practice for helping some of these issues. And they're reasonably common, these sorts of problems. We need to talk about red flags, of course. So to be safe practitioners, we need to be aware of when things are severe and need referring on to health professionals. And the most important, I think, of these are postpartum hemorrhage and postpartum psychosis. A postpartum hemorrhage is a loss of blood. The definition is over 500 mils in the UK, but as I said earlier on, women can actually lose a tremendous amount of blood actually at delivery. And if you're an acupuncturist who goes to births, I hope you haven't witnessed it, but you may have done. Because of this big placental bed, it is possible for an enormous amount of blood to end up in the bed. Health professionals, the midwife, will be running around trying to get the uterus to contract. They'll be putting up intravenous infusions and trying to minimize the effects of the blood loss and to stop the woman going into shock. And very sadly, of course, in the old days, before all these things were available, it wasn't that uncommon for women to die from postpartum hemorrhage after birth. As acupuncturists, if you're not attending births, you're more likely to see the women postnatally, but it is possible for her to still be bleeding heavily several days after the birth. And if she's not being seen by the midwife anymore, then it is up to you to check out whether this is an abnormal amount of blood loss or not. Postpartum psychosis we will discuss shortly, but it is a very severe condition and must definitely be referred to medical services, but we'll go into that in a bit more detail shortly. Other things to consider referring to the GP. If a woman comes to the clinic and has a discharge with an offensive smell, she may actually describe this to you, but I'm sorry to say you might actually notice it yourself, and this can be a sign that there are retained products, and it is essential that it is referred back to the medical team. It can lead to septicemia, and I know that sounds dramatic, but I have actually looked after women who have developed septicemia from retained products, and it is crucial that they have medical treatment as they can become severely ill and sometimes fatally. We talked about the vulnerability of this large open area, and so it's not difficult to understand that they can easily get an infection, and midwives teach women the importance of hand washing before and after changing their maternity pads, particularly to reduce the incidence of streptococcal infection, particularly group A streptococcal infection, which can come from poor hygiene and actually can be severe, as I said. Persistent abdominal pain. Well, apart from after pains, which we talked about earlier on, which are normal, persistent severe abdominal pain is not normal. And if you palpate the abdomen and it's very tender, this isn't normal and should be referred back. Again, it may be a sign of retained products. A raised temperature after 24 hours from the birth is not normal and may be signs of an infection and needs to be referred back. And then pain and tenderness and heat in the calf muscle could be signs of a deep vein thrombosis. Women are more prone to this following childbirth, so don't ignore it. If you're worried, then make sure that they have been seen by their GP or health practitioner. And then, of course, this could lead on to a pulmonary embolus with signs of sudden sharp chest pain and difficulty in breathing. And again, this is a medical emergency. Pain, redness, heat and swelling in the breast can be a sign of mastitis. Earlier on, it typically presents as a sort of wedge shape, like a piece of cheese radiating out from the nipple. And it can be in various parts of the breast. It's not one fixed area. It's really due to usually blocked ducts, and so whichever area is affected, that's where you will see this typical red wedge shape, and the woman will feel unwell, quite complaining of flu-y type symptoms with aching. But I'll go into that in a bit more detail in a minute. Persistent oozing from a cesarean section scar. This also is abnormal and does need referring back. So let's look in a bit more detail at postpartum hemorrhage. It's defined as bleeding which soaks more than 1 pad per hour for several hours since delivery. And nowadays, with women going home so early, it may be that you are in contact with her, particularly if it's a friend or a relative that you've been treating. And so it's important to recognise what's normal and what's abnormal. It also can be indicated by persistent bright red heavy bleeding after 4 days postnatal. By this time, the lochia should be changing colour into the sort of blood that happens at the end of a period, so it's starting to go a kind of browny red, and then changing again to a more watery pink type of loss. Women who are breastfeeding will get little spurts of blood as breastfeeding stimulates the uterus to contract and causes a little bit more blood to be lost. And sometimes you can have women whose blood loss is going sort of brown, but when they breastfeed, they have a little bit more red. This isn't particularly abnormal, and as long as it's not severe and continuing in between breastfeeds, then it's a normal physiological mechanism. But anything outside that should be referred back to the midwife, health visitor, or GP. So from an acupuncture point of view, well, it depends on the clinical manifestation. So we need to define whether it's due to blood stasis or Qi deficiency or blood heat. And you can find that out in all the usual ways, by questioning, looking at tongue and pulse, and by palpation and examination. Points that might be useful are do 20 to raise Qi and support the uterus. Spleen 1 we know is a great point for stopping uterine bleeding from women who have menorrhagia. Spleen 8, spleen 6, large intestine 11 if there's blood heat, and spleen 10 and liver 3 are all useful points that I've found. But again, you really need to differentiate the underlying cause as you would normally. Postnatal depression and puerperal psychosis. As I said earlier, it's quite normal to feel tearful and flat 3 or 4 days after the birth. It is such a huge life-changing event. But when women are becoming a little bit more unsettled and finding that they're not sleeping, and I don't mean because the baby's keeping them up, they actually do complain of insomnia. They have a low mood and lack of appetite. They're not interested in eating. And this can progress to becoming more severe. So let's just look at the slight symptoms. So insomnia, low mood, and lack of appetite. These can be signs of postnatal depression, and they may be enough to cause a woman to go to her GP. And there are scales that can be used by midwives, health visitors, and general practitioners to score various symptoms that the woman is complaining of. And this will give them an idea about the severity of postnatal depression and a guide to whether it's becoming more severe, and also a guide to treatment. Many of these women will be put on medications such as amitriptyline, and of course most of them don't particularly want to take it, and particularly if they're breastfeeding their baby. So as acupuncturists, we can do an awful lot to help at this stage to not only treat postnatal depression, but to prevent it becoming any worse and to get them off their medication. And I have had really good results with this in my clinic. Particularly women would come back if they'd been treated by us antenatally, so they knew that the benefits of acupuncture, and would come to us as a sort of line of support in the postnatal period. So even if they'd already seen their GP and been started on medication, you may find that they contact you saying, look, I've been put on these drugs and I really don't want to take them. Can you help me? And the answer is yes, and you can do an awful lot to support them and get them through that difficult period. Now, what I want to flag up is when this becomes more severe, and the signs of this are when they might start behaving rather out of character, really. They might have abnormal laughing or crying. They might become agitated easily. They could be trembling, and particularly if they're isolated at home, they are in a very vulnerable and potentially dangerous situation. There is a condition called puerperal psychosis or postnatal psychosis. It is a severe condition and it requires urgent referral to a GP or anybody you can actually get hold of if you are with a woman who's in this state, and they will need referral to psychiatric services. I trained as a general nurse before I trained as a midwife, and I did my psychiatric placement in locked psychiatric wards in London, and I saw 2 cases of puerperal psychosis or postnatal psychosis. One woman had tried to throw the baby out of the window, and the other woman had, we were looking after her baby for her, and she walked around in a zombie type state. She didn't even recognize her own husband or her mother or any member of her family, and she literally walked around the ward with a vacant stare, not recognizing or acknowledging anybody. It was the most upsetting thing I think I've ever seen, and I couldn't believe that women who had no psychiatric history at all could end up in such a dreadful state. So I really want to flag this up as something that you must recognise and get help with. If a woman is in this state, it's way beyond acupuncture and needs professional help. That isn't to say that acupuncture doesn't have a role to play later on, but these women are at great danger to themselves and extreme danger to their babies. So first and foremost, they must be treated properly. There are fantastic support networks out there, and a family member of mine is involved in this, having had postnatal psychosis herself, with no warning at all, and a great surprise and shock to all of us, but has recovered and is doing a lot of work towards helping other women. And so are many other women, who've been through this experience. And I would guide your patients and their family members at the appropriate time, of course, to the website that you can see on the slide. And this kind of support can go an awful long way to helping people understand. It is a condition that isn't well understood in general, in my experience. So points for simple postnatal depression, as I said earlier on, things Part 7, Yin Tang, Do 20, Gallbladder 13 and Do 24 are all points I've found very helpful, but you must again do your differentiation and try and work out what the underlying cause is. Is it heart and spleen yang deficiency? Is it kidney and liver deficiency? Is it just blood deficiency? Or is it a stagnation of liver qi with liver fire rising type of pattern? And obviously you need to address that underlying cause. So breastfeeding and mastitis in a little bit more detail from before. Insufficient lactation, mostly qi and blood deficiency, particularly blood deficiency, or possibly liver qi stagnation. There's a lot of emotional issues around breastfeeding and even social issues. It's getting much better now, but there was a sort of stigma to breastfeeding your baby in public, and certain women, with all the will of wanting to breastfeed, do find things like breastfeeding in public rather awkward and difficult, and even in front of family members, and take themselves off to a little room. And to me, I can see this being a little bit of stagnation beginning, that kind of tension, and also if they've got a little bit of sore nipples from the baby not being attached very well, or just frequently feeding, they tense up, their shoulders go up, and you can see that sort of stuckness beginning to come into play. And that's where I find gallbladder 21 with acupressure and massage is hugely helpful and something that I really recommend teaching patients nice and early. So apart from using these points to promote lactation, we could also think about moxa and other points according to the pattern that you find. With mastitis, again, this can be toxic heat in the stomach or gallbladder channel, depending on the distribution, and this can lead to stagnation of chi and blood. Large intestine 11 can be used to clear the heat, and stomach 18, a principal local point for breast disorders. And small intestine 1 is a really good point for not only promoting lactation, but also for stagnation in the breast and mastitis type issues. And other points here I've just included are things like liver 2, liver 3, stomach 44 and gallbladder 41. These distal points I find are really useful in cases of mastitis according to which channels involved. I had a patient who contacted me at 8 months postnatal. Strictly speaking, as a midwife, I should have stopped seeing women at 28 days postnatally, but we stretched the rules a little bit to 6 weeks. As I said earlier, this is considered by some to be the end of the postnatal period, although this is very debatable. So when this woman contacted me and told me that she'd had mastitis 6 times, and each time she'd been put on courses of antibiotics, and somebody had told her that they'd been treated with acupuncture for mastitis postnatally much earlier on, she contacted me and said, look, I really don't want to stop breastfeeding, but I can't go on with having all these antibiotics, and I feel so ill every time I have mastitis. And she was having to express milk and just feeding on one side and all of these awkward issues. And so I felt rather sorry for her and sneaked her into my clinic at the hospital. During her first treatment, she commented, and it was really rather beautiful, that she could feel a tingling and a sort of movement going on in her breast. And she did incredibly well. And after just 1 acupuncture treatment, she never got mastitis again. She contacted me at 18 months postnatally to say, I've just stopped breastfeeding my baby and I never had mastitis again, and thank you so much. I'm really grateful. So you can still have amazing results a long time after the birth, and I really encourage you to do that, preferably much earlier on, of course, and before somebody gets into this kind of pattern. So in my experience, it's a wonderful treatment and can go an awful long way to help keeping breastfeeding going. And of course, that has great benefits for mother and baby. Okay, so let's look a little bit now at resources. In the UK, there are groups of acupuncture for childbirth teams. These are acupuncturists who have a special interest in childbirth, and you can see that lots of different branches, and there are more springing up all the time. And they have websites, and they have an awful lot of time spent doing CPD, learning more about obstetric care and postnatal care. They get involved with births, and they are great supporters of women postnatally and learning how to help with things like breastfeeding and obviously providing acupuncture support. So depending on which country you are in, you may want to consider either joining one of these teams if you're in the UK or Ireland, or think about setting them up. They are fantastic support and a really dedicated group of acupuncturists who are doing wonderful work towards getting involved. We talked earlier on about mother warming, and I'd just like to show the DVD that Deborah Betts has made with Tom Kennedy, and some of my patients are included on here. It's really aimed at teaching acupressure for natural pain relief in labour, but there is a section on mother warming with quite clear instructions and demonstration of how that can be done. So if you happen to have this DVD, and there is also an app that you can get for Android and iPhones. You can flick through, if you haven't really gone that far in the DVD, if you flick through to near the end, you'll find the mother warming technique there. And this has actually been translated into many different languages. So again, it should be available depending on which country you are in. Research resources, well, there is some research on postnatal acupuncture. It's included in the briefing papers from the Acupuncture organisation in the UK, and also in the Research Resource Centre fact sheets from the acupuncture research body at the British Acupuncture Council. And of course, a literature search will probably turn up some studies on postnatal acupuncture, but probably not that many. It isn't an area that has been researched very well in the West in terms of acupuncture. But if you are needing to try and promote postnatal acupuncture and you're being asked for evidence, then it is quite important to look at the literature and see what is available so that you can have a clear discussion. Look at forums, look at other postnatal resources, groups like National Childbirth Trust and other similar bodies in your own country. A lot of women can feel quite isolated following the birth, but there is help out there. There are other women going through similar things. And just as forums exist for antenatal issues like hyperemesis, they also exist for postnatal issues, as I've highlighted with the Postnatal Psychosis site. It's important that women understand that it's okay to be feeling overwhelmed, tired, but also a bit bemused by the emotional issues around being a mum, all the changes that happen physiologically, how long it's going to take to get their body back, all of these things. They need a lot of support and don't necessarily have it around, sadly, in the West so much now from family and friends. And I think as acupuncturists, we play an important role here. We have time to listen. We have time to engage with that woman and reassure her. So apart from our treatment and what we can offer with our needles, and of course, if you're herbal trained, then a huge amount can be offered, particularly when it comes to building qi and blood and nourishment. I think Chinese herbs can have a very important role to play here. So I encourage you to get involved with this group. Make sure that if you're seeing women antenatally, you discuss postnatal options, that it doesn't all end. She goes off to the delivery suite, and that you engage with her, make a plan about possible contact postnatally, and make sure she realizes that you're there for her, should any issues arise. And maybe just consider about what we've discussed, the role that you can play about just supporting her recovery during the postnatal period, even if there aren't any particular problems, even if nothing seems to be going wrong, that you have a role to play to get her through that time. So thank you very much for listening. This is my email if you would like to contact me about any cases or problems that you might have. I'm very happy to help if I can. There are lots of social media groups I'm sure you're aware of on Facebook, for instance, but a word of caution to think about some of the advice that's put up there. It's tremendously variable, and I think we just need to have a word of caution about reliability. So thank you for listening. I wish you very well in your postnatal care of your patients and their families and their partners, of course. We mustn't forget them. And again, thank you for listening.
Given how much a woman's life changes after having a baby, how would an acupuncturist need to set themselves up in order to be able to accommodate the needs or the different time zones? Or how do you suggest that acupuncturists manage their clinic so that it's more convenient for postnatal women to attend?
Yeah, good question. I think you need to be very flexible, and I think you need to consider the possibility of home visits if you can do that. And I realise that not everybody can. Um, and maybe just being available, possibly out of hours. Most women would want to bring their baby to the clinic with them, particularly if they're breastfeeding and they have to travel. So maybe thinking about facilities to support that so that their partner can come with them, for instance, or their mum and take care of the baby while they're having their treatment. So I think the main answer would be flexibility. Um, I realise that not everybody can do home visits, but that if a woman is very tired and actually can't get to the clinic, that then you may want to think about whether you can offer that as an option. Is that a reasonable answer?
Yes, I think so too. And that was sort of where I was angling, thinking that, of course, and having had two kids myself, the idea of trying to get organised enough to be able to get into clinic, particularly if you're not feeling well. And I think it's something that acupuncturists need to consider if postnatal acupuncture is something they're interested in, that may include having to extend their service to home visits as well, or having some form of flexible arrangement with their patients.
Yes, exactly. Yeah.
And the interesting thing, I was really struck by your talk when you talked about postnatal, the definition of postnatal being so short, because it really, you made the comment that really it's sort of up to 12 months, and it's certainly something which I've experienced personally, as well as a lot of the friends that I met through mothers groups, and I feel that there's a misunderstanding about some of the definitions of postnatal, because it's seen as immediately after childbirth, and certainly for me, personally, the issue of postnatal depression and I'd like to share with our audience and my own personal experience of, I thought postnatal depression was that you were sad about the baby and that this happened within, as you said, day 4 of delivery. And what it occurred to me, and it's something I've since spoken to a lot of people about, is it's really, you're looking at more like the 4 months period. It's sort of after the euphoria has worn off, and it's once the sleep deprivation kicks in, it's really in that sort of 16 weeks period that it seems to sort of that was my experience anyway. And again, it was there was never any negative feelings about the baby so much as just it was like life in crisis. It almost felt like a midlife crisis, I think, rather than, I wouldn't have called it postnatal depression at the time. But yes, and that's
Yeah.
something I think, and that's obviously when coming in contact with an acupuncturist can be so effective, because it's obviously something. The alternative is something like looking at antidepressants. What's your personal view on the prescribing of antidepressants for postnatal depression?
I don't have a lot of experience of which drugs are actually used now because it's constantly changing, as you know, with the pharmaceutical industry. Um, I do agree with you. The definition I gave at the beginning is very much a midwifery definition of the postnatal period. And again, this will vary very much from country to country. But yes, it is a short definition. It's a short time. And actually, women, I don't think you really get your body back after having a baby for a year. I mean, maybe even longer. And certainly, as you say, with postnatal depression, some women do go on, they will say, I was depressed for a year after having my baby, and it was labeled as postnatal depression. And so defining that is difficult. Is it the overwhelming responsibility and the exhaustion of coping with a new person in your life, particularly when you've got more than one baby and you've got other children to look after, and other social issues that you may have to be caring for other people? Um, so yes, it's very woolly. People talk about 28 days, then they talk about 6 weeks when you go to see your GP for your 6-week checkup. And then you have those days, as you say, with the euphoria kind of wears off, the visitors stop coming, and you're suddenly left there on your own trying to do the shopping, the washing, the cleaning, and all the rest of it, plus look after the baby. And then there's the thing about going back to work. Um, there's a kind of social pressure, and people, I think, particularly now that women are more career orientated, there's a pressure of having to get back to work, excuse me, and that can come and play a huge part. So again, in terms of medication, is that being used to try and get life back to normal, whatever that means? Or is it being used to get back to work? Or is it being used because they really need it and nobody's thought to take them off it, even though they're feeling better? This is just huge. It's such a huge issue. Um, Again, I go back to what I said earlier, where I think as acupuncturists, we can do an awful lot to support. And if a woman comes to the clinic with saying she's on postnatal antidepressants postnatally, um, then I don't think it's up to us, and I don't think it's safe for us to reduce or stop that medication. That should be done in conjunction with a health professional, so that the treatment, as she starts to feel better with the acupuncture, then she will know, I think, instinctively, hopefully, that she's in a position to go back and discuss with her health professional about actually reducing her medication and seeing how she gets on, continuing with the acupuncture so that there's a sort of reducing scale as the acupuncture continues to help her improvement, that she can reduce and eventually come off her antidepressants.
Indeed, and it strikes me that some of the issues I think that women go through, is exactly what you said. You alluded to it perfectly when you talked about having a baby, then having to do the washing, the ironing, and the dinner, and the cleaning the house, and all of a sudden the distribution of domestic work falls so heavily on the women where previously it might have been shared, and that's certainly
Yeah.
something that I think it's been really interesting to socially watch these professional friends of mine having to go through this place of all of a sudden becoming domestic housewives, and that it's in itself being part of the issue of triggering a whole cascade of identity crisis and all sorts of stuff around what the definition of being a mum and what that means in terms
Yeah.
of your role within society, and it's such an interesting journey. And I think that I almost, do you think it's fair that we redefine postnatally? Is it's actually almost like that you don't really come back. It's not sort of postnatal as a period. It's you have a baby and that's it. Your life changes
I lost you
forever.
there. Sorry, yeah, I lost you a
Oh,
bit there. You said
no,
you don't really come
well,
back.
I was sort of thinking about that idea of getting your body back and getting yourself back, and after a year, and thinking, I don't know whether you ever do. I think it's really, I think there's a really, I sort of feel like
Oh, well, I'm a lot
it's.
further on than you are.
I was going
With
to say,
a
I'm speaking with
17-year-old
it.
and
I've got
21-year-old, I can assure you that it
you get your life
happens.
back. It's really funny because I'm speaking with a 2-year-old and a 3-year-old, so it's really funny. I still feel like
Yeah.
still feel like I'm in the trenches in that sense of just
Yes, of
yeah,
course.
it's
Of
just
course, but it does get easier. And where and how can you define what that, when is that actually, when is that date or that time chronologically where all this happens? And of course, that comes back very much to the individual, doesn't it? How can we
indeed.
put a label on what is postnatal for one woman versus what's postnatal for another?
This
And
is
maybe
it.
I should have made that point at the beginning, but
Oh no, I think
um,
you did make that
I
very
think,
clear, and you made it very clear. Also, I like that idea that it was a medical definition, and that it really, in terms of societal application, it just doesn't really fit because as you say, that the physiological process of having a baby, or the biochemical changes, and then the actual life change. It's such an interesting journey that I don't think you can almost measure that and say it doesn't end. You can't sit around and say, right, at the 6 weeks or the 4 weeks or the 12-month mark, that all comes to an end and everything resumes to normal, the magical normal.
yes, right. I think
So,
for myself, I remember feeling it was about a year before I didn't feel milky or, being dominated by my tummy anymore and kind of, I mean, I remember lying flat on the bed and managing to pull my jeans back on and do up my zip and just whooping with joy. I mean, I could hardly stand up, they were so tight. But that feeling of, wow, I can actually wear trousers with the zip again. That wasn't a year, by the way. That was much earlier on, I'm pleased to say. But again, with society, looking in magazines and girls who are back in tiny clothes at an alarmingly quick time after the birth, um, I find that kind of worrying, really, because it's not normal. And depending on cultures, um, what are we trying to do? when we are we denying the fact that we're mothers by getting back into skinny jeans on day three? Um, what is all that about? And I think we have to be very careful to recognise that this is having a baby is physiologically, emotionally, absolutely huge. It's wonderful. It's life changing. But my goodness, it needs a lot of care to get over.
Indeed. And what would be your advice for acupuncturists then, if they felt that their patient was in that mindset? How might you advise a patient? What would be the language you'd use?
Ooh, I think we have to be very careful again because I think they're in a kind of vulnerable state and suggestible. So I think the language you use has to be chosen very carefully. And I'm not sure I would like to actually give an example because we have to be careful not to tip them into some kind of guilt trip. Um, that's not going to be helpful, particularly if they are a bit low in mood already, for instance. I think we come at it like we usually do from traditional Chinese medicine angle with suggestions about importance of self-care in terms of nutrition and rest and getting help and that it's okay to ask for help and maybe that kind of thing. But I don't think we should criticize or make them feel bad in any way. I don't think that would be helpful. I think we have to be very careful and be gentle with our suggestions and promotion of ideas. But again, as I said earlier, I hope that we can start this with our patients if we're seeing them antenatally, so that we're already getting the suggestion in there about getting lots of help. Um, really think carefully about when you want to go back to work and think about getting meals ready ahead because you're not going to have time afterwards and sowing the seed for the importance of the fact that it's going to take time and that's okay and that they shouldn't feel pressure to rush back into things. So maybe sowing the seed early. I don't know.
That almost sounds a little bit like coaching women through what antenatal care is like, and it's been really interesting. Again, my personal journey in going to antenatal to prenatal classes and being reading books, and everything seemed to lead up to childbirth. There was this incredible sense
Mm,
of that it was almost sort of that childbirth was the end, and that you close the chapter, you close the
yes,
book at the day that you deliver a happy, healthy baby. Nothing went on to say what the consequences of that would be. There's so little literature about that period immediately afterwards, and I think one of the things you've also highlighted is there's a little bit of a loss of role. Because of course, right up until the day you deliver, you're under the care of an obstetrician or midwife or health practitioner, and so once you've delivered, you end up in a little bit of no man's land unless you've got a problem, unless there's something that's obviously medically needing more observation or treatment. But I think there's a bit of a sense of, it's quite literally you get handed your baby and you're discharged and off you go. And then it's your responsibility to, other than, sorry, I should be fair, I certainly, the UK experience is that there are follow-up appointments. And as you say, there's a 6-week GP appointment. But that's a long time between delivering a baby and having
yeah,
a medical consultation that I think and this is obviously where I think there's such an opportunistic role for an acupuncturist to come along and say, I'm happy to come and visit you one week, once a week at home, or just to keep an eye on the
yeah,
person, because those systems do
yeah,
exist, but I think that they exist for people in desperate need. I think if you're happy and well and the baby's happy and well, you really are on your own a bit more, and that's where perhaps an acupuncturist might be able to play a much more influential role. Have you got any thoughts about that idea of women being sort of left on their own devices as soon as the baby's born?
Oh, absolutely. And I think as I said earlier, it'll vary from country to country, and culturally, as to what is sort of so-called normal. But you have to think about geographical issues, because even in the UK, where our hospital was in Plymouth was a big naval base. So we had women who had been moved from hundreds of miles away from the north of England, so they didn't have any family or friends around and they were stuck on these naval bases with their husband either at sea or due to go back to the sea from leave. uh, as soon as the baby's born, they get given something like a week or 10 days, and then they've gone. So these poor women are really isolated, and apart from the health professionals going in at first, or nowadays actually, they have to get themselves up to a children's centre, which is pretty exhausting. Um, and as soon as they're deemed fit, then they're discharged. So what happens then? There they are on their own, very isolated, coping. So yes, I think the idea of an acupuncturist going in as even just a supporter really, is a great idea. But again, that would depend on the practicality for the practitioner. But yes, I think it's an area that we could really do with improving on. Um, Again, it's very individual. You will get families who are hugely supportive and women who are very motivated, they're well educated, and they're well informed. But sadly, it's not always the case.
Indeed. And I think that's a lovely parting note, is realising that as acupuncturists, we do have a set of skills that we can offer to help the physiological and medical conditions that someone's going through, but also just as an extra support person and maybe helping hand during quite a difficult transitional period as well. So now, are there any other considerations
Yes.
before we wrap up that practitioners should be aware of when they treat people antenatally?
No, I think, it'd be nice if you could pick up a couple of these things we've just been discussing, which, I maybe not didn't cover well enough. But yes, I sort of tried to cover the things like the red flag type stuff and treatments of conditions. But I think this point that we've just been discussing about general postnatal support is a hugely important role. And I think if you talk to acupuncturists, they find it very satisfying. It's a nice role to play.
And particularly too, when a lot of acupuncturists will have had a relationship with someone, sometimes through the prenatal, through maybe helping somebody through IVF, through
Yeah,
pregnancy, and then actually being able to continue that role. And it's certainly something, I do remember of that, how much you take such good care of yourself when you're pregnant, and you invest so much in your health and your well-being, and then as soon as you have a baby, that all gets transferred onto the baby. So I think, and it's really
yeah,
reminding women that they need to maintain that in order to be able to be fit and well to take care of the babies. They really should keep up their acupuncture. They really should keep up their exercise and eating well, all the things that they would have done during the pregnancy. But it's obviously the most difficult thing is to maintain that with the demands of a new baby.
yeah. Yes, and I think as acupuncturists to remember that, you will have, particularly if you've been involved with infertility treatments, either with or without IVF, and you've gone through the pregnancy with a woman, you have developed a very special relationship there. So don't let it end when you've heard that they've gone into labour. You have a very special place in that person's life, I think. So to make sure you can try and keep it going.
Indeed, that's a lovely parting note to end on. So, Sarah Bud Bell, thank you so much for your time today, sharing our fourth episode in our series of pregnancy, safely treating postnatal conditions. So, thank you again for your time and also those fantastic links and resources as well.
Thank you.